Valentine's Day just around the corner. There are hearts just about everywhere you look. But February is also National Heart Month. And here to discuss some affairs and afflictions of the heart is cardiology specialist Dr. Shoba. Dr. Shoba, let's talk about this. National Heart Month, I mean, we got Valentine's Day in there, but it's just a natural fit, isn't it?
That's right. You know, February is Heart Month,
right.
And February 3rd is Wear Red Day.
Right.
And so just a reminder to people
right.
to think about their hearts. You need to think about your heart every day.
Every day.
Every day.
Mm-hmm.
But you know, February is just a reminder.
Right. Just to get out there and show other folks that you're thinking about them too. Wear
right.
a little red on February 3rd, but keep Heart Month, you know, in the back of your mind.
Right.
And recently, you know, we've seen some indications of broken heart syndrome. We've heard about it in the news. Carrie Fisher, you know, she passed away. A couple of days later, her mom passes away. That's just one example. There is a broken heart syndrome, isn't there?
Unfortunately, there is. And unfortunately, we see a lot of it in the Tri-Cities area, especially in this East Tennessee area. Broken heart syndrome is a condition that is caused by stress.
Right.
Most likely it is emotional stress, but also physical stress can also do that. Emotional stress is, you know, if you've lost a loved one, that is the most common cause. But then you can have other issues as well. Any emotional stress, you know, you're in a romantic relationship, that doesn't
right.
go through. If you have any physical injuries, like you've had a sudden stroke, you've had burns, you've had injuries, or you're used to, you do physical activities that your body is not used to, that can also cause stress. Now sometimes, you know, happy emotions can also cause stress. You know, surprises
right.
can also cause stress, and they can cause heart attacks, but those are very rare.
Right.
It's mostly the negative sort of feelings that cause broken heart syndrome. In fact, it's a type of a heart attack. You actually, if you start having classic chest pain, you get short of breath, you get tired, you have all the symptoms of a heart attack, you go to the hospital and they'll do an EKG and that may show signs of a heart attack. They do blood work and it shows heart enzyme elevation like a heart attack. However, the biggest difference between a regular heart attack and a broken heart syndrome is you don't have any blocked arteries
right.
for the broken heart syndrome. And the heart takes a peculiar shape. It is called apical ballooning syndrome. That means the tip of the heart just balloons out and the base of the heart squishes real strong. Right. So it has a typical, like this Japanese octopus pot, you know, shape, which is why it's also called Takotsubo heart attack. It is also called stress-induced cardiomyopathy, apical ballooning syndrome, but the most common term is broken heart because truly emotional stress is what causes it.
It just amazes me that, you know, you could have clean heart health and all of a sudden that onset of stress could cause all of these symptoms.
Right. Typically it affects women in their 50s, 60s, you know, menopausal kind of women. Right. However, unfortunately in our area we are seeing younger and younger ladies with broken heart syndrome. I've seen men with broken heart syndrome, so it's not unique to women. Right. More women have it. Right. More older women have it. But Tennessee, I tell you, we do not know how to deal with stress. Stress is causing a lot of heart disease in Tennessee. I mean, our diet habits are bad, our right. exercise habits are bad, our smoking habits are bad. We have a lot of diabetes, we have a lot of high blood pressure. However, we do not know how to deal with stress in our area. In fact, I wish we could somehow take anger management and stress management to our classrooms, to our high schools, to our colleges, to our medical schools, so that we all learn how to deal with stress in our life.
I was going to ask you, if you're in a situation where you've lost a loved one or there's some stress in your life, what do you suggest that they do?
I think, you know, being around people that help you deal with the stress is important and not to contain it within yourself. Right. And if you have symptoms like I mentioned, chest pain, shortness of breath, don't ignore it. Don't think it's all because of stress. The stress could actually be hurting your heart. The good news about broken heart syndrome is it will actually heal completely. The heart muscle will recover completely. Right. The heart muscle pumping function gets very weak immediately, but then in a few weeks to a few months, it's completely back to normal. And so that is the biggest difference between a heart attack permanent damage versus broken heart damage, because this is reversible. A lot of good family support will help you.
But if you're showing those classic symptoms, then you need to get some help right away.
Right, because it could potentially kill you. You know, you can have a rhythmic event, you know, heart rhythm gets out of, you know, the heart goes out of rhythm, or you have congestive heart failure.
Right.
So, you know, if you survive the initial event, you should be good long term. And nobody knows the statistics, because so many people have chest pains when they have stress, and they don't go to the doctor. So we
just
don't
think it's
even
the
know.
stress, right?
Exactly. And what if you have broken heart?
Right. Take care of yourself.
You too.
All right, and take care of yourself. If you're showing any of those classic symptoms, get some help right away. If you have a lot of stress in your life, get some help.
Yes.
Find someone to talk to. That's the best way. And one place you can start is there at www.heart.org for more information. Dr. Shoba, thank you for being with us today.
Thank you very much.
All right.